He is one of the spearheads of current fascia research. Well, Dr. Robert Schleip. Thank you very much. When you listen to individual fascia preachers, you get the impression that fascia training is the be-all and end-all, and in the future we only need to engage in fascia training and that's it. Well, this is complete rubbish. Fascia training, and I try to explain it to you in detail, should be a modest supplement in addition to a health-oriented motion training. Muscular training remains top priority also when you are aging. For being optimum, it may be meaningfully supplemented by a neurocognitive training. I call it the brain. This also includes the central nervous systems and other parts of the body, and then the fibrous collagen tissue. Well, that tended to be neglected in the past. That's the fascial connective tissue. In my presentation, I would like to shed some light on the interaction between the three systems and how you can focus on them in different ways, not in separate ways, but how you can meaningfully provide supplemental training. Who knows the physiotherapeutic area and treats the three areas at the same time, he will be reminded of the model of joint stabilization Manohar Punjabi introduced into literature for meaningful joint stabilization of the vertebral joints, for example. At any rate, you need the active systems, that is functioning, working muscles, and they are then controlled by the central nervous systems. And what is important is that the passive tissues, the joint capsule, the then ligaments close to the joints, and now the superficial connective tissue is included, so that this passive tissue also allows the movement. So this is a well-known model, and there we have sound research, studies conducted, Pilates, core stability areas, functional training. We quite rightly pride ourselves to have EMG-based studies that show that the transversus abdominis, for example, has got a completely different function for back stabilization than the erectus abdominis. Just like the multifidus, they are muscles that are instrumental in joint stabilization in different ways. And the Feldenkrais instructors on the other hand side say that muscle training on its own without the right neuronal stimulation cannot be the be-all and end-all, because muscles only do what the brain tells them to do. And so the therapist shouldn't train the muscles of his patients, but the mental images in the head. Well, this is the motor cortex, and that will contribute to differentiation. So this would be muscular training associated with Feldenkrais, neurocognitive training, and in football it's very much up and coming, and in many areas too, that via eye training you improve leg mobility. So they try to make the brain faster, to accelerate the speed of your brain, not simply making the muscles in your legs and the fibers faster. So in the past 2-3 years, many things have happened. So on the one hand side, you've got the brain on the one hand side, and the muscle on the other hand side. What was tended to be neglected, however, is the fibrous collagen connective tissue, and this is something which is colorless, seemingly structureless connective tissue. Well, you know from your preparations at university, and you were glad once you had cut it off as a section and then put it in one of the blue temporary garbage bags, and then anatomy became a wonderful thing to do. So it was negligible, just like the gift wrap of a Christmas gift in relation to the gift proper. So you have to package it somehow. The most important thing is the muscle, the liver, and the rest, is more or less the wrapping. And this has changed dramatically now. So the fibrous parts, the seemingly gift wrapping paper has got essential functions in muscular strength transmission. This is the flexion relaxation phenomenon I'm talking about here, where standing up when you slightly bend your back forward so that the head is no longer supported by the skeleton, and when you measure then the active muscle tonus and the erector spinae, the more the head is bent forward, the erector spinae have to work, and as angle of 25 degrees, there is a paradoxal reduction of muscle activity in the erector spinae. Even though the head keeps moving forward, the erector spinae becomes linear and move the holding work over to the so-called passive structures. That's the thoracolumbar fascia and then the density of the fascia and the spinal ligaments. But quite interestingly, with most of the back pain patients, this doesn't work. So when somebody's got a healthy back and when they move forward, it's like turn into a shape of a hunchback, and then they work strongly, these erector spinae, and then fascia take over. And when the fascia is used to that, the muscle can relax. When the fascia is not used to that, they might say, well, this is excessive strain. And then your back trainer says you shouldn't bend down in this hunchback motion, because this could bring about some damage in the fascia. There was some rethinking, however, when you recognize this flexion relaxation in healthy people. It would mean that it's positive over the year to have the right dosage of hunchback strain when you shovel snow, for example. When you leave it out, the back will not get stronger. Unused means that it will wither away, and this applies also to the thickness and the ability of collagenous structures to take strain. So maybe the fascia in the back, there are 3 different layers in the back, that they do have a stabilizing function in healthy people. And you can see it when you take a look at the EMG measurements in toddlers. In the first year, when they are up there bent down, they mostly bent down as if they had read a Bible 800 pages long. We said, when you bend over, you should always do it from your hip joints downwards. Well, little toddlers at the age of 1 and 2 prefer this way of bending down. One explanation is that the first 2 layers of the lumbar fascia are not fully connected to the lumbar vertebral, and so the erection relaxation phenomenon, which should be healthy, is not working yet. So they always bend down in order to avoid that they put strain on the lumbar fascia and put strain on the muscles. So at an age when the fascia can be strained, they bend down with a round shaped back 50%. When you only bend down beneficial to your intervertebral disc and the fascia, you should always do it with a stretched back. If you never ever bend down hunchback fashion and with a small backpack, then it gets thinner and thinner. And when once a year you take something out of the back of your car so that your back moves into a lumbar flexion, there is a micro rupture, and you say, ow, didn't I know that I'm not supposed to bend down hunchback way? Your brother, who's working at a construction site, says, dear Robert, I've got a different view. Take a look at me, and then you would need a modern ultrasound. My back fascia is a leather-like rubber cloth, 2 millimeters thick. It's not very gossamer thin paper. You come 3 to 5 times a week and help me at the construction site, and then we carry bags. You help me out there when I chop my wood in the forest, and then, well, next year you will also have this rubber cloth lumbar fascia on your back. It has to be well dosed. Unfortunately, here in English, there's a wonderful contribution by Serge Krakovetsky. He explains how the correct neuronal activation of the transversus abdominis actually works. This is what the Pilates people call the powerhouse, or at least large part of it. This is the inner, muscle of the abdominal wall, how they can have an impact. And, if not the lumbar fascia, that's the third layer, doesn't have the right geometry, it doesn't work properly. He shows it right here.
Tighten the transversus abdominis, what happens is that you bring the tip of the transverse processes closer together.
Sieht man wunderbar.
Now, Poisson is a French engineer 150 years ago, determined what he called the ratio of how much travel you have here versus how much travel you have here. And the best tissue have a Poisson ratio of 1, which is 1 inch here will generate 1 inch there. The fascia has a Poisson ratio of 1. This is the ultimate in efficiency.
Also,
So what you could nicely see there is, well, right at the end, that the horizontal fibers of the transversus abdominis in a young person are in a shear pattern and grid-like structures, well, to the transversal processes. They showed it with spinous processes, but the tension is transmitted in such a way that L1 and L4, get closer together. So counterintuitive. When, as a weightlifter, I lift a barbell from the floor, I should only activate the erector spina, but the inner abdominal muscle should contract, not only due to the intra-abdominal pressure, but due to the shear grid contraction from L1 to L4. So an abdominal muscle can be a spinal erector, so to speak, but this doesn't work when your lumbar fascia is like a felt cloth. You can pull as much as you want. L1 and L4 never come closer together. So I think about how can I engage in an EMS training? How can I have a different mobility training for training shear like grid geometry? And we would say, well, include rotations into your back training. So when I'm only exercise movements in the sagittal level, I will probably not have this two-directional shear grid model that forms part of the lumbar fascia. On the other hand side, shear grid fascia wouldn't help you if your brain wasn't then ready to activate the transversus out of an expectation of pain. And when the transversus is degenerated, you have to build it up by means of EMS and other muscular strengthening methods. But you need the brain, you need the muscle, and then you need the right fascia geometry. And in back training, this is a wonderful example indeed. The fact that the fascia can be a source of pain, is something we could see when we investigated sore muscles. We know that main pain occurs 1 or 2 days after extreme strains, and it was surmised that we're talking about micro damage here. When there is electrical strain there that goes far beyond the physiological area, the damage is also in the Z disc, in the muscle fibers as such. And in terms of physiological strain, we don't know where the damage occurs, whether it's the muscle fibers, the red fibrous tissue, or the white fibrous tissue, the muscular connective tissue. But now, based on 2 recent studies, we know that the source of the pain, where are the free nerve endings that hurt us, that this is more in the muscle shell, in the muscle sheath. When somebody takes a dumbbell and, puts it down, eccentrically breaking breaking with the right arm and lifts it with the left arm, then the breaking right arm after 1 to 2 days will have sore muscles. Then this is the electrical study. When you add a small electrical impulse in the subcutaneous tissue of the skin, it doesn't hurt. But when you then have got the sheath of the biceps brachii, then a small electrical impulse hurts you in the arm with the sore muscles. Well, the same impulse in the contractive muscle fibers won't hurt you, won't cause any pain. And then in the brachialis underneath, it's just the same. So in the future, when somebody says, I've got sore muscles, you can simply brush them off and say, no, now it's called, sore fascia you're suffering from. Because the sensitive nerve endings that hurt, why they hurt is not something we have found out. Maybe some sort of liquid, but where do the ruptures occur? In the muscles and the fibers. But the source, the local source of the pain seems to be in the fascia sheath and the fascia shell. This is what I showed this morning. This is the most profound fascia research study by Harold Langeman. When we've got chronic back pain patients, the sheer mobility of the lumbar fascia is more baked when we've got a passive forward movement versus the underlying muscles. This is what you would like to have. You want to have the first fascia layer and the second one that is thinner. You would like to have, them moving against each other and that they are joining forces towards muscles. And when chronic back pain occurs, this is more rigid. In the past, for example, one Professor Booth, I don't know whether he will also attend this time, he said, just take a look at the fascia tissue and muscle fibers, how they're closely intertwined. And this is only making money all of a sudden coming up with fascia training, because each and every mobility training also co-trained fascia, so to speak. How can you put a strain on a muscle and exert a muscle without putting a strain on a fascia? And this is plausible. Karin Albrecht and other experts say that targeted fascia training is a sham. It has always been included whenever you train your muscles. There's no need for a separate fascia training. But for Buse and others, they sort have changed their opinion and shared the interpretation. Exclusive fascia training is impossible, of course, but a focused fascia training, a targeted, a dedicated one, which focuses on the adaptation mechanism of the collagenous, connective tissue training. And so some experts simply made a U-turn in their opinion. It's not the explicit, but a focused trainability of this area. A triathlete, doing some general training, gets stronger muscles compared with a couch potato. His brother, for example, engaging in bodybuilding, exercising, they train primarily muscle strength and hypertrophy, and so the cardiovascular condition will also be a little bit better than that of the couch potato, but only on the side, so to speak. So when the bodybuilder starts during the triathlon and says, I also had cardiovascular training, they will quickly find that they trained it, but only not in a focused way, but only as a sideline, so to speak. And the same attention was put to fascial connective tissue. Whoever goes jogging during the week and lifts weights only trains their fascia tissue somehow, and for optimum exertion, it's not enough. So for somebody who goes jogging more than 5 times a week, 5 to 7 times, has got a higher propensity to kinestheny, and that is then pathologies. That is just like a couch potato. When you do it twice a week, this is not the case. So this means that sports may can overtrain collagenous connective tissue, even if it's the right thing to do for your cardiovascular system. And so how do you dose sports? Not to do something on the side, but to have an optimum training for collagen firmness and stiffness. This is Keith Pardon. We had last year in Ulm. An artificial collagen, living fibroblasts are added, and we say, come on, multiply, and then we've got the artificial collagen ligament, tendon, and then you stimulate this with a regular, mechanic strain, which is, a sports induced strain. You look at the development of collagen production then. So with a 1% elongation, collagen production is not increased. So in this particular experimental setup, you need a minimum of a 2% extension or stretching. Then we have a 4, 5, 10% elongation. And a cyclical strain doesn't bring us an essential increase in terms of collagen production. With a muscle, this is different. Muscle training is just like a dimming device. You can adjust continuously. So, old people, that might suffer from osteoporosis, they shouldn't use maximum strength when lifting weights, but only 50% maximum strength. And then the muscle will also build up, but not as fast as with others. It's like a dimming device turned up 50%. Well, with tendon training, it's like this toggle switch. I have to hit a few times in such a way that the fibroblast message understood. And now in the next 1, 2, 3 days, I trigger collagen production. And it won't help me if I then hit the toggle switch 100 times more. This is enough. So for this, we need a relatively high strain to strengthen the Achilles tendon. Well, with a 50% maximum force, the Achilles heel gets 0% more in terms of strength. The calf muscles gain in strength, but for the Achilles tendon, there's not 1%. For training the tendons, I need more than 50% maximum strength in order for anything to happen. So I have to exceed the threshold value, 70, 80, 85% of maximum force, and then things get exciting. I come back to that, and repetitions won't do the trick. So after 40 reps, once I jumped 40 times, I can actually, when I talk about the Achilles tendon, stop, because 400 jumps will not give me a major increase. You rather run the danger that you have overdosage, so to speak. So what is exciting is the intramuscular connective tissues, and there the toggle switch has a lower threshold value. When I jump with 50% maximum strength on my Achilles tendon, 1 millisecond, that might suffice to get the intramuscular connective tissues in the calves to over a minimum period of 3 months to become more resistant to a tear. Well, adaptation threshold for intramuscular connective tissue is lower, but for the tendons, I have to exceed a high dose repetition a few times. And there you have to be careful, because when I do it 30% too strong, then I might run the risk of acute injury. So when I hop and I jump, I can only do it when I've got sensory attentiveness. I cannot have a phone call at the same time or watch a video at the same time, because then I run the risk of injury. And now, highly exciting, it's from the Copenhagen lab. There are more researchers who do research in sport and the connection with collagen connective tissue production. So after sports strain, the connective tissue production is increased, and collagen degradation too. What wasn't known is that in the first 1.5 days, the degradation takes precedence in quantitative ways. So when it may be a left shift so that somebody with adduction times can accelerate it. So you might run the danger that when you do fascia training every day, you might potentially weaken the effect. But when you do your training on a Monday, Wednesday, and Friday, then you then come into excess synthesis regions. And the main researcher, with Professor Parampax is something that's great. They looked at a stress protocol in terms of tendon reinforcement and strengthening. And here our hopping, the training, the jumping, this reinforces and strengthens the Achilles tendon. This would be a static 15-second isometric strain-based training. Also does have an effect, but a specific tendon training he developed where 3-second high dose Achilles strain comes up, 3 seconds break. You do it 4 times in 1 set with a total of 5 sets. So when you want to strengthen the fascia and do not want to soften it, when you want to make the Achilles tendon more tear resistant, this is the optimum protocol they established. What they didn't study, and what others did, is the elastic storage capacity, so to speak. And there are some studies that say that hopping is maybe more effective than than lifting weights. And this is a study from, where they had several older, male persons hopping on 3 times a week with 75% maximum intensity, 4 times 10 seconds. Originally, they did it for strengthening the bones, but it didn't have any effect on osteoporosis. So they could say, well, we failed in our study, but the storage capacity in the, Achilles tendon, dramatically, significantly improved. This means we try like torn yarn to, dig out like spring-like movements, not for strengthening the muscles, no, for keeping a youthful, elastic, rubber-like storage capacity and reinforce this capacity. So the jump height increased, not because they have got more fast-twitch fibers or stronger muscles, no, because the tendon, develops towards a kangaroo. It's like, storage capacity for kinetic energy. And this is where EMS and fascia training come together. What I told you speaks in favor of having high-dosed, fewer strain, distributed over, a week, 2 to 3 times. This is not only beneficial to strengthening certain muscles, but may also be the optimum solution for fascia. The 3 different types always interact, but they set different conditions in terms of optimum tissue performance. When I want to train my brain more, we used to say in the past to turn it into a habit, we will move differently, hip joint, whatever. I need 20,000 or more repetitions. This is true under normal conditions. But when dopamine is there released in the brain, only few reps suffice. Dopamine is released when you are enthusiastic, when you're curious. And so I'm always the scientist who kept criticizing these, missionaries who always think everything is wonderful, black and white, complexity is avoided. Well, this is an ideal thing to do for releasing dopamine in your brain. And when you've got a trainer who's enthusiastic next to you, and when you are then enthusiastic about doing your EMS training and fascial exercise, you do not need 20,000 repetitions. When you are attentive at the workplace, the smooth rolling motions are then internalized, and this is an important thing to bear in mind. So for the brain, you do not need stupid repetitions. No, you need enthusiasm-based, curiosity-based repetitions. Well, for muscle training, you heard this before. In the other presentations, you require a break of 48 hours. It's similar to fascia, but what is best is high intermittent intensity, high dosed strain, and a muscle can adjust in a few weeks' time. So the upper arm circumference may also show you measurable strengthening after 6 weeks. Well, fascia don't give you that. They respond slower. In 3 weeks' time, you won't have a measurable improvement, but in 3 months' time, you will certainly get it. So you need breaks for regeneration. And now, last but not least, before we conclude, for muscular training, one of the most important things, it's meaningful, just like in EMS and other types of sports, that you've got a well-dosed muscular strain, which is exerted, but if possible in an area where there's optimum strain and exertion for the muscle. When you do not want to, well, then train your fascias on the side, but in a targeted way, I would say 1, 2, 3 times. Also have this jumping, spring-like motion you should add. And occasionally you should have this final grade angular ranges, which in everyday life are excluded. And then last but not least, for the brain. Well, you need curiosity-based enthusiasm, and this is one of the main things fueling you. Well, a little quiz right at the end. Question: if for over a period of 1 year, 1 week, you had time to train your muscles or fascia, or to, well, then train your brain, well, for coordination purposes, well, what would be the healthiest? A gym with no brain? Only train the brain, but not, well, use any muscles, Sudoku, eye movements, or have fascia training. So in front of you, you've got the fascia nerd. What response do you expect? All the 3 of them. And what if you had to decide? Well, the answer is surprising. Muscular training is the most healthy thing, because there we've got neurotransmitters that are anti-aging for muscles. They are released into the blood, well, vessels, and the fascia will benefit. So muscle training is still the big brother, and we, the fascia nerds, we are the little sister, so to speak, and it's healthy to add us, but not to, well, push the big brother off stage, so to speak. Thank you very much for listening.